Hi, my name is Dr. Kirsten Lin, and I'm one of the co-founders of Direct Care Physicians of Pittsburgh. The reason I'm coming to you today is because I recently read an article in the newspaper that caused me great concern, and I wanted to share that article with you and talk about possible solutions to the problem. So let me go ahead and share my screen. Here you see the title of the article, What's Causing Women to Skip or Delay Medical Care? Well, this article was written by Deloitte Center for Health Solutions. Back in February of 2024, they conducted a survey of about 2,000 US-based consumers, and they also conducted an actuarial study looking at medical claims data and came up with this report. So again, they found that while both men and women did skip or avoid care in the past year, this was disproportionately more common for women, to the tune of 35% more likelihood. When you look at the specific services that women delayed or skipped, you will find that acute care was at the top of the list. So that is things like cold and flu symptoms, urinary tract infections, yeast infections, and things like that, that women are not receiving care for. Also, if you look down the list, preventive care and women's health issues, those are things like pap smears, mammograms, and our cancer screening programs, vaccinations, and things like that. Mental health services are also on the list. And one item that they did not study in this survey was about pharmaceuticals, but we also know from other research that women do also tend to forego pharmaceutical treatments, typically based on cost as well. And what happens when folks are skipping or delaying care is that, number one, we miss diagnoses. Number two, we find that when they do present for care later on, the severity of the illness has increased. And number three, because that severity has increased, also the cost of treatment has increased. Here we look at specific reasons why women are choosing to skip or delay medical care. And you find that affordability is right at the top of the list. We know from other research that healthcare and health insurance costs are number one household expense, and that has been the case for many years now. Also, people are finding that it takes a long time to schedule an appointment. It also takes a long time sitting in the waiting room, waiting to be seen once you do get to the doctor's office. And people are busy, they have jobs, they have children they need to take care of. Maybe they're caregivers for other adults, and they don't have time to be sitting for 1 or 2 hours in the waiting room waiting for their appointment. Sometimes they didn't feel well enough to visit the doctor. There were transportation issues. But the second to last one is something that I get concerned about, is that the women reported having poor previous experience with a healthcare provider for one reason or another. The reason that people are skipping or delaying healthcare comes down to three reasons. One, affordability. Two, access. And three, prior experiences. Now, as I mentioned, I'm a direct primary care physician, and I believe that the direct primary care model addresses all three of these issues. First of all, affordability. In the direct primary care model, we have fully transparent pricing. There are no surprise bills. Patients know ahead of time what they will be paying for the services. Also, in direct primary care model, we have the ability to care for most issues for most people in the course of a year, simply because we have enough time to do so. Number two, access. In the direct primary care model, typically there are no long wait times to schedule. There are no long waits in the waiting room. I know in my practice, we have a negative waiting room time. In other words, if the patient arrives early, we can typically see them early. Flexible scheduling. And then also we can leverage telehealth. Again, if people have difficulty with transportation or just the busyness of their schedule, we can leverage telehealth for that. And also with access, patients are able to communicate with us in other ways. They don't always need to schedule an appointment. Sometimes they can send a text or an email and expect a response back on that. And then finally, the patient experience. This might matter more than anything else. Patients want to feel heard. They want to feel cared for. They want to feel that they matter. And it is our job as physicians to make patients feel that way and to feel comfortable in our offices. This is what builds trust between a doctor and a patient and keeps the patients coming back for their routine care and for the other types of care that they might need. So while this article was very concerning to me, it shows, it highlights some of the flaws of the traditional healthcare system. It also highlights the strengths of the direct primary care model. And we hope to serve you in the Pittsburgh region through the Direct Care Physicians of Pittsburgh. Contact us at www.directcarepgh.com.